Welcome to Label Alert Extra's How-To Spotlight, where this month we will explore understanding the impact of the FDA's two proposed rules which will redefine nutrition labeling on packaged food products. Hello, my name is Christina Bechtold.
And I'm Jesse Zilke.
We are both with Prime Label Consultants, a Washington, D.C. regulatory consulting company specializing in food labeling and the upcoming massive change to the Nutrition Facts panel. Over the last 25 years, companies have optimized their food packaging to the Nutrition Labeling and Education Act, passed in 1990. Companies have adjusted the size of their containers, changed their formulations, and used insider knowledge into the serving size rounding rules to get the smallest, most favorable panel that supports their brand image. Now 2 decades of optimization is going out the window. And to magnify this impact, many claims that are based upon the nutrition panel, such as low fat and high fiber, will have to change as well. So with changes to the panel, companies will need to decide whether to relabel, repackage, reformulate, or in some extreme cases, remove the product from shelves. In order to make this determination, the first step is to understand the impact of the proposed regulation on your products. So what do the two proposed regulations change? First of all, you will notice that the new panel is larger, 5 to 100% larger. The larger size will probably reduce the area you have for other elements, such as ad copy or claims. Second, you will notice the much larger calorie number, which may have a significant impact if your brand targets health-conscious consumers. Third, you will see that the daily value percentages are left aligned. There is a new, much shorter footnote. And in addition, some panels will be required to have a second column. This represents a greater emphasis on the total amount of nutrients in each container. Next, we will look at the changes to the data inside the panel, the nutrients declared and their amounts. The most controversial addition to the panel is the added sugar line and its daily value percentage on the left. For the first time, the FDA is saying that not all nutrients are created equal. It matters where the sugar, and for that matter, the fiber, is sourced from. If the sugar or fiber is intrinsic to an ingredient, an apple for example, the sugar in the apple is not considered added sugar, and the fiber in the apple counts toward the dietary fiber number. But if the ingredient is a sweetener or fiber isolated from its natural state, fruit sugar or oat fiber, for example, then those ingredients need to be tracked manually and must be declared differently on the panel. Only very few isolated fibers currently qualify as dietary fiber. Popular fibers in use will need to go through a petition process at the FDA to qualify. This puts many fiber claims at risk. You will also notice that vitamin D and potassium have replaced vitamin A and C on the panel, and that vitamins for the first time will need to be declared in units as well as percentages. Finally, a second regulation on serving sizes is changing about 17% of the reference amounts and adding several more. Because the panel data is directly driven by the serving size, this will disqualify many claims and allow new claims. So let's look at the foods affected by the changes to serving size. You will notice that in the bakery category, the reference amount for bagels and muffins is doubling. This means that there will be twice the amount of good nutrients in each serving and twice the number of undesirable nutrients. We will see an example of this in a minute. You can see here that many FDA food categories are affected. Note that the USDA is expected to release the meat and poultry changes soon. In addition, the daily value targets are changing. This is the amount of nutrients that Americans are suggested to consume by the government. So what was once a low sodium or high fiber claim may no longer qualify.
Now we'll walk through a brief case study to illustrate how many of these changes may impact your own products. The sample is a 10-count mini-bagel, low in fat, and an excellent source of dietary fiber. The current nutrition panel is shown on the right, and you'll notice the serving size is 1 bagel, 100 calories, with optimized fat and dietary fiber values for the claims. Now on the right, we can see the nutrition facts panel as proposed under FDA's new nutrition rule. You'll note that the footprint is significantly larger, mandatory dual column labeling has much greater nutrient values, and the serving size is increased to 3 bagels. Perhaps most importantly, we'll notice that the high fiber claims and the low fat claims are no longer eligible on this product. So while a manufacturer may decide to simply obtain the new information that's required in the panel and relabel the product, it may be more advantageous to consider optimizing the product to the new nutrition rules. Package size could be increased from a 10 count to a 12 count bagel, bringing the net weight from 15 to 18 ounces, which would again give us a single column nutrition facts panel. However, it would not change the nutrient values, and nor would it provide us with the high fiber or low fat claims. So we could take it a step further, and the manufacturer may decide to actually reformulate the product. In this sample, we show the bagels going from 43 to 45 grams each, fat being removed, improved fiber being added, and low-calorie sweeteners being added, or some of the sugar being removed. Here we would again have our single-column nutrition facts panel. However, we've now adjusted the nutrient values to be more favorable to the brand identity, and again we have the high fiber and low fat claims eligible on this product. Of course, optimizing the nutrition panel for the product and the brand is only one part of the process. New data requirements and changing regulatory definitions of some nutrients will require manufacturers to obtain new information from suppliers or from testing. In many cases, data management systems will need to be restructured. As we've illustrated, there's a much more significant impact to the proposed nutrition regulations as simply swapping out a new nutrition facts panel. Here we've seen claims lost, nutrition facts panels changed, and entire product identities altered. As you can imagine, this is an enterprise-wide impact. In most companies, regulatory may be responsible for determining what the specific impact is, but marketing will have to determine how significant it is on the brand identity. Purchasing will need to work closely with suppliers for new and updated information. IT may need to redesign software and data management systems, while R&D may need to reformulate and create new product identities. So how long do we have before all of this takes place? Expected publication of the FDA's final rule is March of 2016. As proposed, the effective date is 60 days following publication of that rule. Depending on how it is written, this may mean that all new and refreshed packaging would need to be in compliance at that 2-month mark. Mandatory compliance for all products is proposed to be 2 years following publication. However, we may see changes and more leniency from FDA on both of these dates.
So as you can see, there is a mountain of work to be done. But despite this huge amount of work, with the proper preparation and planning, you can navigate this seismic shift in a way that makes sense for your brand and your budget. Over the next several months, we will highlight each of the next 6 steps in our Educate, Plan, Execute methodology. Next month, we will explore Step 2, Team, Timeline, and Training. You have seen how this transition has an impact across the enterprise. We will discuss how to form a SWAT team, educate them, and begin the planning cycle. A good understanding of your products, their vulnerabilities, and the competitive landscape can help you develop a phased transition plan that takes advantage of the government timeline instead of it taking advantage of you. We also recommend immediately starting to perform this kind of case study analysis on your own high-profile products. The impact will vary widely across your product categories. So please explore the rest of this newsletter. We have developed checklists, a best practices section, additional resources, and tools and trainings that will help you navigate Nutrition 2016. And if you need more assistance, Prime Label Consultants and SGS are available to assist your company for your specific needs. We look forward to continuing the conversation with you next month. Please read on and enjoy.